Hello, everyone. How can Ayurveda help with weight loss? Well, all of us must have tried some sort of diet to lose those extra pounds. We are going to find out and talk to Vaidya Reena Arora, who has been a practitioner for over 20 years. Dr. Reena offers a personalized Ayurvedic diet based on your personal constitution. She has helped hundreds of clients heal from chronic conditions as well. Dr. Reena has been a practitioner and a researcher of international repute. I am Amita from Nourish Doc, a global platform for natural and holistic therapies. I'd like to introduce all of you to Dr. Reena Arora, who's joining us live from Delhi, India. Welcome, Dr. Reena.
Thank you, Amitaji.
Okay.
Should I start now?
Yes, absolutely. You're welcome to start.
Thank you. As Amita has introduced me, I am an Ayurvedic practitioner from Delhi, India, and I am treating all the cases by purely Ayurvedic medicines, yoga, meditation, diet advices, and all these things. Today, my topic is obesity. Okay, so next slide, Amita. Hmm. What is obesity? I am giving brief background about this. Obesity is accumulation of excessive fat in the body which may have negative effects on health, reduce life expectancy, and increase problem. This is very common, all of us know. And current estimates suggest that the global prevalence of obesity has increased by twofold from 1980 to 2014. And in COVID pandemic, this would have increased even more. A major proportion of diabetes, ischemic heart disease, hypertension, osteoarthritis, and cancer burden may be attributed to overweight and obesity. One more thing which is not mentioned here is psychological problems due to if your appearance is not good, you lose your confidence and many things get damaged due to this problem. Next slide, Anamita. Yes. In Ayurveda, atisthole or obesity is described as excessive accumulation of fat or adipose tissue and mass dhatu, that is flesh or muscle tissue, leading to flabbiness of hips and breast. It is considered as one of Santarpanot vikaras. I will like to emphasize on this. There are two type of vikaras and two type of treatment according to Ayurveda. One is Santarpanot vikaras and other is Aptarpanot vikaras. Santarpanot vikaras means we are taking excessive calories as much are not required by our body, our profession, our age, our disease. And Aptarpanot vikaras mean we are taking less diet as much is required for us. Like a child is taking only salads in this growing age, and a person who is sitting whole day in the office, not doing any physical activity, and is taking rich diets, and a laborer is taking salads. So these are different type of diets which are wrong diets according to our work and our calorie requirement. So this is the meaning of Santarpanot vikaras, that is which are due to excessive diet. Not only obesity, diabetes, cholesterol, liver problem, fatty liver problem, and many other such type of problems occur due to these Santarpanot vikaras, that is excessive calories without so much of work. Next slide, Amita. Yes, as the main cause of this is increased intake of energy dense foods that are high in fat and carbohydrates. I will give one example of this. In some families, there is a fixed routine in the morning. They take rich prantas or such type of rich diets in the morning. They think that breakfast should be king. No doubt they should be king. But if you work like a king, only then you deserve a breakfast like a king. If you are not doing anything, you are getting up at 10 in the morning or 12 in the morning, then you are taking this rich calorie laden breakfast. Where will this breakfast go? So, and next is overeating and irregular food habits. Overeating and irregular food habits, according to Ayurveda, I will give one example for this line. Like I have taken a breakfast right now. After 10 minutes, something very delicious comes in front of me and I take this. This is overeating. That is adhesion according to Ayurveda. Your previous food is not digested and you have taken next diet. Although it's small, but you have spoiled your digestion. So you should not do this if you want to maintain your weight. And irregular food habits mean There is no time of lunch, breakfast, or dinner. You are taking any time, you are going to gym any time, and you are sleeping any time. These are irregular food habits. Lack of physical activities due to sedentary lifestyle in these days of COVID pandemic, and even without COVID, some office goers have not any time for exercise or any other physical activity. They start their day from the morning getting ready to office, and then in the evening they are tired and they take their dinner and they sleep. This is the lack of physical activities. Then genetics. In some families, parents are obese, then children are obese. So genetics is also plays role in this disease. Then endocrine disorders like hypothyroidism, it's very difficult to lose weight for thyroid patients. Then medical reasons or psychiatric illness. If you are a patient of depression, then you eat without thinking. So this is also one reason for obesity. Then daytime sleeping is very important. If you want to lose weight, you should not sleep in the day. Daytime sleeping, people will think that I am saying about only afternoon sleep. No. In the morning, even you are getting up at 10 a.m. or 11 a.m., this is also daytime sleeping. If you are sleeping after 6 in the morning, this is daytime sleeping. Next slide, Amita.
Yeah, so I just wanted to expand on it. You talk about the psychiatric illness. So, like a lot of people, especially today's day and age, right? COVID, they're having emotional, all of us are having some kind of emotional upheavals, mental issues, not mental issues in a very strange way, but anxiety and stress.
Yes, yes.
So a lot of us resort to some kind of a snacking or some in between. We'll go and take, I don't know, some energy bar or some kind of a snack. So
Hmm.
that also is not good, is what you're
Yes,
saying,
yes,
right?
yes,
I just
yes,
want to make sure we understand, all of us understand what you're saying, right?
yes. I want to tell one thing more about this. As Amita, you have
Yeah,
raised this question. See, the ups and downs in the life come and go, and financial problems, other tensions, they will come. There is not a red carpet for everyone, and
correct.
we should not change our routine for these problems. Like in COVID pandemic, everybody is suffering little or more. We
Yeah,
should not change our routine for this. People have spoiled their routine. I have seen. If
yeah,
the teachers are teaching from home or students are studying from home, they get up at 8, they brush their teeth and on their laptop and sit there. No bathing, no exercise. Then their
yeah,
mothers are giving them breakfast at 10. Then after school at 1, they are taking bath. So this is, you can think about this. If 2 years children will do like that, then many problems will arise. Obesity, and juvenile diabetes and many other PCOD. So we
yeah.
should think about this. I will
So
mention
those are
about
emotional issues, right?
yes,
Due to emotional issues, these all these issues are happening.
yes, yes. Parents also play a major role in this. You should have a strong mind. These things should not affect your routine because these will come and go. But if you will suffer from an illness, then you will go for the treatment of this only. Your routine
Correct.
will already be spoiled.
Yeah.
Yes, next. Yes,
Okay.
breathlessness. These are the symptoms of obesity. Breathlessness, even on little exertion or physical activity. Then lack of interest in doing work. There's inertia in obese people. They don't get up easily. If you will say something, they will take time or they will not get up. Profuse sweating with foul body odor. Excessive hunger, because this is also a reason for obesity. Feeling of tiredness. Whole day they will say, I'm tired, I can't do that. Excessive sleep. They can sleep anytime. Then next slide, Amita. Yes, this is the diagnosing of overweight or obesity. How you can say that you are obese or not? You should calculate by this. That is body mass index. Overweight or obesity, I have given the indications about this. A healthy person is whose body mass index is 18.5 to 24.9, and the body mass index of overweight person is 25 to 29.9 kilogram per meter square. Body mass index of obese person is greater than or equal to 30 kilogram per meter square. How you will calculate this body mass index? You measure your weight in kilograms, divide this by square of your height in meters, and then you can diagnose whether you are healthy, you are overweight, or you are obese. Then you can decide your treatment pattern, dietary changes, and other lifestyle changes. Next slide, Amita.
How will you do in pounds? Like what would you divide it by? Height in not in meters then, right? Or
Yes, you convert this to pounds then.
converts that to pounds and then
Yes,
just
yes,
say the same
yes,
thing in height in
yes,
meters,
yes,
right?
yes,
And then you can do
yes,
exactly the same thing.
yes.
Okay, because in US the people we do pounds, not kilos. So
Hmm.
okay, okay,
Yes, this is also this is
obese.
extremely obese is greater than 35 BMI. Only
Yeah.
this slide indicate this. Next, this is the table you can calculate about the body mass index from this table, which I think person every varies from person to person, so people can calculate of themselves.
Hmm.
Next, yes. Now, when we are diagnosing overweight or obesity, we should also consider waist circumference because BMI plays a role, but circumference also plays a role. Uh, Central obesity and decrease of risk in individuals with BMI less than 35 kilogram per meter square. So, our waist circumference also be normal. In men, this is 94 to 102 centimeter, and in women, it's 80 to 88 centimeter. So calculate your waist circumference. If it is more than that, then you come in obese category. Further, following lab investigations are recommended to assess the risk of obesity related health problems, lipid profile, blood glucose, blood pressure measurement. As I have already mentioned in Santarpanoth Vikaras, lipid profile increase usually because of the kapha increase in our body due to no physical activity, sedentary activities, and fat or rich calorie foods. Next slide, Amita. Yes. Now I come to Ayurvedic management of obesity. First, we do the shaman treatment. This is a simple. I give the medicines to the patients. Second is langhan, that is fasting in between. So give a good gap in between the two meals. When you are feeling hungry, actual hunger, a hunger like a laborer, then you should take your food. You don't see the time that I should take the jeera charge, or I should take the meal now, or I should take the snacks now. This is the evening time. No, you see your hunger. Whenever people see the diet chart or the for the obesity of the other person, they should not follow the same diet chart because this varies from a person to person. This is the beauty of Ayurveda. If you are an obese person, your age is middle age, and you are a sedentary worker, you are a menopausal lady, the things will change from one person to another because in menopause, hormones change. This is also responsible for increase of weight. And if you are stressed, you are taking the medicine for depression. Even then, your diet will change, so, diet chart varies from person to person. This arm pachan is oral use of digestives to augment the fat metabolism. Means arm means in Ayurveda, excessive toxins deposit in our body. We digest these toxins by use of digestive medicines. Then Ruksha Udwartan is dry medicated powder massage. This barley is also used. Some other medicated powders are used for this, which decrease the kapha in our body and increase the blood flow and help in losing our weight. Then heavy and non-nourishing diet items like honey and salads are advised. I will like to add one thing here. I will not recommend salads to everyone. Like a person who is in old age or in menopausal age, she should not take only salads. She should take rather less diets, but with desi ghee. You will surprised by this because if she will take salads whole day, vata will increase. Her weight will not decrease even a single, even 1 gram. But if she takes diets according to Ayurveda by showing her prakriti to an Ayurvedic doctor, only then she can lose her weight because you should know your constitution whether you should take this thing or this or not. Only then you can see that which diet is good, which activity is good for you. Like I would like to give cite one example here. Some people start excessive gymming for losing the weight, which is not good for everyone. And we treat our body like a machine. In the evening, when we are free from office, we go to gym. At 10, even people are going to gym according to Ayurveda, which is very wrong. This is the Vata time, which when we should sleep. The exercise period is in the morning, which is Kapha time. And I have read research papers also on this. If you exercise in the morning, the effect is more and it's good effect on the body. And if you are exercising at night, People are going to gym at 8 or 10 in the night. This is wrong for our body. Our sleep is disturbed. We become overactive at this time when there is time to sleep. So these little things we should be aware of for losing our weight. Next slide, Amita. Yes. Physical exercises and mental work is also recommended. This is very important. In our textbook Charak Samhita, this is written. The main cause of obesity is nishchintita, means there is no worry. You're eating, you're enjoying life, you're sleeping in the day, you're taking good foods. This is the main reason for obesity. So there should be some stress. I am not saying that there should be excessive, but you should take some load. If you have no load, take load of other people and help them so that your weight is maintained. And then Sanshodhan Chikitsa. These are purificatory procedures, that is Panchkarma procedures of Ayurveda, which help in losing weight, like Vamana therapy. This is therapeutic emesis, and in which we give the medicines and vomiting is induced. This is also for clearing the channels of the body. Then Virichan, this is therapeutic purgation, in which again the steam and massage is done for 7 days. Then medicines are given. Then body clears and you become a new person, a youth is invigorated in this person who is taking these Panchkarma therapies. Then Lekhan Vasti, it is medicated enema are advised for the management of Stholle. These are the medicines which decrease fat in our body and help in losing weight. Next. Yes, these are some single drugs, but don't take without the prescription of a doctor, because as I have already told that these vary from a person to person, like Giloy, Bidang, Musta, Shunthi, Amla, Vacha, Daru Haridra, and Gugul. These you can take. Then compound formulations, Trikatu, that is salt, marich, and pepper. Salt is dry ginger, marich is black pepper, and pepper is also another variety of this. Then Navak Gugul is a medicine, Trifla Gugul and Vidanga. These are the names of medicines. Then Takrarish, Navayas, Low, and Arogya. These are also the medicines according to Ayurveda. Next slide, Amita. Yes. Unhealthy diet results in building up adipose tissue in the body, resulting in weight and obesity. As I have told these things, physical activity lessens the energy imbalance between calories consumed and required. Hence, intake of healthy diet, sufficient fiber. I will like to add some things here in healthy diets. I am giving some examples. Like if you're eating dal or pulse in the night, you should take in the afternoon because protein is heavy to digest. And the thickness of pulse also depends how much you want to lose weight. You should take thin diet. If your consistency of that pulse is thick, you are prone to gain weight by this because this is heavy. So for decreasing the calorie count, consistency of your pulse should be thin. Then you should take small meals and take according to your hunger. Don't take according to your time. Then next thing, when one food is digested and you are actually feeling hungry, you are feeling the need to eat something, only then eat something, otherwise don't eat. In the morning, when your stomach is not clearing and you are taking your rich breakfast like a king, this is causing a blunder in your stomach because the previously food is fermenting there, it's not excreted out, and you are adding more foods. As we are adding rice and half cooked rice, neither previous rice will be cooked nor the later rice will be cooked. Same we are doing with our body, and more toxins will be deposited in our body and we will suffer from more diseases. So, always take food when you are feeling hungry actually. Hence, intake of healthy diet comprising of sufficient fiber. Pulses are also very good in fiber. Fruits and vegetables. Adopting active lifestyle. Practicing yoga and meditation to manage stress and fatigue are highly recommended for prevention of overweight and obesity. Next slide, Amita. These are lifestyle modifications I have explained. There is mild to moderate exercise according to individual capacity. Don't see others that she is doing gym for half an hour or 1 hour, I should do the same. Always, it's written in our books, we should do the yoga or exercise according to our capacity. As much strength we have, half of that strength. This doesn't mean that you are about to fall and you are doing exercise up to this much time. Then regular habit of brisk walking for about 30 minutes. Avoid sedentary habits. I have explained this. Excessive sleep and day sleeping. Avoid watching TV while having food. This is common. And alcohol and smoking. Next slide, Amita. Yes. Take low food and low calorie food items, but Vata predominant people should take little bit of fat like desi ghee, but take food when you are hungry. This golden rule will apply in every case. Take more proteins in the afternoon to stay longer without food. Then steamed, boiled, or baked vegetables are good. Then fried. Frequent small meals. This is good, but even again, I am saying only when you are feeling hungry. Drink skimmed milk instead of whole milk, or cow milk is also good. Take healthy food such as oatmeal, walnuts, salad, bitter gourd, drumstick, barley, wheat, green gram, honey, Indian gooseberry, pomegranate, and snake gourd, etc., and skimmed buttermilk. And you can add salads in this list also, as I've explained, like this curcumin and all these things. Yes, next. Include cabbage in daily meal. It will stop the conversion of sugar to fat, and use warm water for drinking, but Pitta predominant people should not take warm water. This may cause harm to them. They should take normal water, and include lemon in diet and drinks. But people suffering from osteoarthritis and pains should take less of lemon or sour things. Next slide, Amita. High carbohydrate vegetables like potato, rice, and the fried foods like pizza, burger, and pasta, or salty foods or excessive salt in meals should be avoided. And more sugary or sweet products, I have yes, more sugary or sweet products I have advised in don'ts, and more dairy products. But I will give substitutes for these food, like you can take, if you have craving for sweet, you take natural sweets. Like you can take sweet potato, you can take dates, these are good. You can take raisins, but don't take sweets in which extra sugar is added. And then salty foods, excessive salt in meals. And one more thing, you should take rock salt in your meal. This is more healthy than these common salts. Next slide, Amita. Yes, I have explained this case. I have treated many patients of obesity, but I'm discussing here some cases. I have treated a lady who was 40 years of age. She has stopped eating her dinner and many other diets, and she was going into depression. She was on only Loki diet, that is bitter gourd, for 1 month. She has done rigorous yoga. She was suffering from joint pain. I have told her, leave all these things, and start taking food properly. Your weight will be stable now. And she started her food cooked in desi ghee, normal exercise and meditation, because she was in menopausal age, and she has done inch loss after that, and she has maintained that. So, and one more girl who was sleeping at 1 in the night, getting up at 10 in the morning. I changed her routine and I told her to sleep at 10, get up at 6, do Surya Namaskar 10 times in the morning. Then you take your proper breakfast at 8 or 8:30 or 9, and then you do your work. Don't sleep in the day. She has lost only by this routine her 5 kg weights in 3 months with little bit of medicines, not much medicines I have given. So this is the role of medicine, simple medications, dietary changes, and lifestyle. So my emphasis is again on lifestyle changes and dietary changes. And one more thing I will like to explain here, we should not take monotonous diet always. Change your diets. Your intestine has to do work more, and this helps in losing weight. Like in some homes, there is a fixed routine. You will get up in the morning, you will get these sandwich, oats, or cornflakes, or smoothies. Change your breakfast, and preferably breakfast according to me are, even because I was a counselor in personal point also, I've learned many things from there also, and I've combined Ayurveda with those calories and Ayurveda. So I'm telling about this, that in the breakfast I'm telling some option. You can take dalia with lot of vegetables, that is porridge, that can be of barley or wheat. Then you can take upma, with lot of vegetables, poha with lot of vegetables. This is rice flakes. You can take with lot of vegetables. This should be main aim. You take lot of vegetables. You should not do starvation for losing weight. You do exercise in the morning. Fix your routine for this. You will definitely lose weight. And now, Amita, you can take the questions, I think.
Sure, sure, sure. Thank you. Thank you so much. We are open for questions. So I think the main emphasis, you're welcome to put it in the chat window. I think that's perfectly fine. So I see quite a few participants in Zooms. So you're welcome to put it in the chat. And these are confidential. I'll stop sharing when you start sending the questions. One of the things that you talked about is the so it's a combination of everything, right? So for example, I'm just trying to say, if someone someone is only like 5 or 10 pounds, or let's say 5 kilos, so that's about 10 to 12 pounds obese, then they probably don't need to go through the panchkarma therapies, right?
Yes.
Or would you, so the panchkarma therapy, I'm just trying to understand. So there are different things that are there. One is the simple lifestyle modifications, like, getting your routine, sleeping on time, sleeping in, eating properly. That's number one. Then number two is, someone comes to you and you talked about the herbs, the giloy. So that's like someone who has a little bit more of a problem, right? And then the panchkarma. So how would you go different therapies based on the weight or based on the severity of someone's problem? Like panchkarma therapy would be someone who's very obese. I'm just trying to understand. The herbs would be someone in between, and then simple lifestyle modifications is someone who just needs to do little things here and there, like you described, right?
Yes.
Can you compartmentalize
Yes.
according to the weight?
Yes.
Is
I
what
am
my
doing.
question is. Yeah.
See, whenever patients come to us, we are not starting Panchkarma on the first day.
Okay.
First, we tell him or her the lifestyle modifications, the dietary advices, and then we give the palliative medicines. Only then, after 1 month or 2 months, he or she is eligible for Panchkarma. In the starting, we can't do the Panchkarma without the uh, palliation of these doshas which are aggravated in the body and which are causing obesity and other diseases. This is the
Okay.
basic criteria.
I
Okay.
see.
And by this lifestyle and dietary advice and simple medicines, some patients lose some weight, and who are over obese, they have to undergo panchkarma. They have to undergo. So this is the
Yeah.
criteria.
So someone, let's say, who walks in with 20 kilos of extra weight, for example. So
Mhm.
they'll go through the panchkarma therapy, and then how much they have to go through, like a 4 to 6 month sort of like a period or a program, so to speak. So because first you will see a simple herbs, if that makes any change, and then you advise them of a panchkarma. So the panchkarma is like every month they have to go through panchkarma for a certain number of months for them to maintain, for them to start losing the weight. Is that how it works?
Yes. Listen, first, I have told you I will advise all the lifestyle changes, the
Yeah.
dietary changes.
Yeah.
Then we will start Panchkarma. And we can't say that this much time you have to undergo Panchkarma. We will decide depending upon the results of that patient that how much he is losing weight. If he has lost enough weight in 1 month, then there is no need of going for panchkarma in the next month. So this
Yeah.
also varies from person to person. The results
Okay.
of panchkarma also varies from person to person, and the quality of life and the lifestyle and dietary changes he or she is following.
I see. I see. So it really depends on the results, what
Yes.
on each person. Like someone, a woman who's a menopause is different from a guy or a man, who has other problems, for
Yes.
example.
Yes. Yes.
Any questions from the audience? Dr. Reena Arora. Okay, I see questions coming up. Okay. All right, so I'm going to stop sharing so that you can ask questions with confidence, with confidentiality,
Hmm.
so that I won't share your questions. I mean, I'll read out the questions. Okay, so someone is asking, specifically persons who switch to whole food plant-based diet that's mainly composed of complex carbs, healthy fats, and oils, not just vata foods like salads. What are typical reasons such person do not lose weight after several months or years of eating this manner when the hormones and blood sugar tests all come normal? So
See,
so I think what I'm trying to understand is someone has switched to whole food plant-based diet.
mhm,
So they're only eating complex carbohydrates, healthy fats, and oils. That all plant-based diet,
mhm,
and not just salads. And then they're still not haven't lost the weight even after going into a plant-based diet. And
mhm.
she's asking that everything else is normal. She probably got her hormone test done, her blood sugar test done. Even then, she's not able to lose weight, right? Okay, please
Yes, yes.
clarify. I'm just trying to clarify your question. You're
Yes,
welcome to
yes. I
put
have
in
read
the
that,
chat.
sir.
Yeah.
I will like to reply this question. I will
Okay.
like to know about this person that
Yeah.
whether he or she is following the routine I am asking about. She is getting up
Okay.
in the morning. Is
Yeah.
she awake at night for
Yeah.
late
Yeah.
nights? And third thing, is
Yeah.
she is doing regular exercises or not? Tell me this.
Okay. Okay. I'm not going to call out your name. So you heard what she said. Are you following a certain set routine the way she described? Morning routine. Okay. So she's saying good sleep, yes. Rigorous morning exercise few times per week. That is what she
Arvind,
said.
you should do daily. And at what time you sleep at night?
Okay, what time do you sleep? And uh, can you elaborate a little bit more?
Hmm.
And if you're following the sleeping habits as she was talking about, 10 p.m. to 6 a.m. So that's pretty good. So that's what you said, right?
Hmm, hmm,
That
hmm, hmm.
so
So
I don't know,
yes,
rigorous morning
coming to this.
exercise. Okay.
See, why obese people come to doctors when there is saturation after doing all these things?
Yeah.
So you are doing all the things good, but even then, you should visit a doctor or you can consult online. And better you consult a doctor again, get your routine checked, your diet checked, and if even then you are not losing weight, then you can take some medicines for this, and which will help in losing weight.
So maybe Panchkarma also. How much are you trying to lose weight, if you don't mind me asking? Like, what is your goal? Like 5 to 10 pounds or 10 to 15 pounds? 15 pounds. Okay, so that's about 7 kilos. That's what this person is trying to lose, about
She has
seven
to
kilos.
consult if by doing all these things, because
Okay,
without seeing a patient I can't say anything. She
correct.
is saying that hormones are normal, but
Yeah,
according to Ayurveda we don't only check hormones. I check many things. When a patient comes to me, I need 1 hour for the consultation. I
I see.
check all the things, the lifestyle, what he or she is following from morning to night,
Yeah,
and the diet he is taking. So I want to know about all these things for telling this.
okay. So you're welcome to reach out to us. If you want to go a little bit more deeper into your issues, we will put you in touch with Dr. Reena. I've written our email. I think if you attended one of our sessions, you know how to get hold of us. Um, um, so any other follow up before I go to the next question you have? That you said 15 pounds you want to lose, but you're following plant-based diet. There might be something else that might be happening, which Dr. Reena is trying to, I think she can only tell you after having a proper consultation, with you or with, okay. So you're welcome to say more. Okay, so now someone is saying, would you please elaborate on Ayurvedic medicines again, shown on one of the slides for addressing obesity? You talked about different Ayurvedic
But
medicines.
again,
And
I am requesting all,
yeah,
don't take these medicines without
yes,
doctor's advice.
yes, yes. And these are
Because
educational sessions. I want to emphasize that. I don't emphasize in the beginning. I want the session to start, but these are only educational sessions, and these are suggestions. These are just commonly used medicines that we talk about. But I don't know if you want to say something.
yes, I want to say something here, Amita.
Okay.
People take herbal medicine easily. They don't take it seriously. I am
Yeah.
giving very common example. Like
Mhm.
people are taking turmeric milk, aloe
Yeah.
vera, and these are common things for
Yeah.
increasing their immunity and
Yeah.
for health.
Yeah.
I am giving one or two bad effects of these herbs for citing an example that don't take anything without the advice of a doctor, even if they are herbal medicines. If you are taking aloe vera and your
Yeah.
periods are more, these will be even more. This
Yeah.
increases bleeding. And if a lady is pregnant, then abortion can occur. And
Oh, I
same
see.
to see the effects, and you will say that Ayurveda has not done any harm. You have not consulted a doctor. Then second is, I was talking about turmeric. This is very good. There are more than 3,000 publications on this, but unmarried girls should not be given this turmeric milk or turmeric continuously, and this causes problem in conception. And one more, this is the drawback of turmeric. And one more thing, same is the herbs I have mentioned in my list. These are very strong drugs, so don't take without consulting a doctor. This presentation I have to prepare, so I mentioned, but otherwise you should not take anything, even any plant, without consulting a doctor.
Okay. And, I can resonate to that completely. I was taking Live 52 by myself, and I started taking all kind of, herbal supplements with thinking that, oh, I'm going to be
Wow.
very healthy. And I got it myself checked, and I had all kind of strange things that were happening with me a few years back. So that's, I'm a living example of that.
Hmm.
Okay. So now we have the same person who wants to lose 15 pounds has a comment saying, before moving to herbal strategy, would it make sense for all dosha types trying to lose weight to consume a couple tablespoons of dietary fiber powder daily?
No, strictly
I
no.
Okay. And why is that? Didn't you want to tell her why she should not do that?
Yes. See, this dietary fiber powder, I don't know what is this. I am giving, I should not take name here because this is a social platform. I am not taking name.
Yeah.
But I have seen patients who are taking such type of drinks which commit that you will lose weight, you will lose so much weight, but
Yeah.
these are affecting their kidneys also. So be aware. Don't take these dietary powders, and please consult a doctor. And I think you are following good routine. This would be easy for you to lose weight.
Okay. Any other comments or any other feedback on the dietary fiber? Okay, thank you. Okay, thank you. Any other questions or comments or feedback? Please, we have a few more minutes. We have I think we have approximately 7-8 minutes. We are happy to take more questions. If you have any comments, any feedback you want to talk about, you're welcome to do that. So there are, a lot of us follow these diets. I'm just naming, without saying
Yes,
anything good or bad.
Anita, they are
Yeah.
saying you show the medicine slide, please.
Oh, okay. So do you want to show? Okay, so I have to share again. I'm happy to share. That's fine. So, okay, let me just go back, try to figure out how to go back now. Hang on 1 second. This was, which one was that? The slide?
This was last slide. Yes.
This one, right? That is this the one that everyone wants to see? I think so. Like that's where you talked about the drugs and the compound formulation. Okay, so what is the question? You wanted to see it and ask questions?
I have a YouTube channel also. You can see my videos there as Dr. Reena Arora for more
So
diet.
let me see. There's a question, Doctor. Okay, so this is the slide, and I'll just stop share and I'll ask. I'll see the question. Okay, so someone is asking about the elaboration of the Ayurvedic medicines. Can you kindly show the slide again? We did show the slide again. Any other comment after the slide you want to see? And then it says, it was a great session. We got a huge amount of information on obesity. Thanks a lot. If you want to have more information, more details, we are actually starting to conduct workshops, which would be nominally priced. These are free sessions, as all of you know. And Dr. Reena and I have been thinking about conducting a paid workshop. We will just do a nominal thing. If you are interested, we will let you know, and we will be starting with Dr. Reena, I think in January timeframe or something like that. That's what we talked. So couple of things we are thinking of doing. One would be a group workshop. This would be a group workshop, which would be a longer time, and she can go into details. The other would be a program that we are going to start. So that's another thing that we are going to start. Any other comments right now? I did show the Ayurvedic medicine slide again. Okay, if there are no more comments, can I wrap up? I just want to ask the audience before I wrap up, because okay, any, so I think the main thing, Dr. Reena, you're saying is these are suggested medicines and herbs, but no one should take it without proper consultation with an Ayurvedic practitioner, right?
Yes,
That's
yes.
your message again and again. Anything you want to add? You're welcome. You're welcome. Very informative. Thank you so much. You're welcome. And we will let you know about the workshops and other programs that we are bringing very soon. Your comments, Dr. Reena, please. Last
Yes.
comments before we wrap up. What would you like to say? The last comments, Dr. Reena,
Yes.
to our viewers?
I would like to say that thank you, Nourish Doc, for inviting me. I request all of you to follow Ayurvedic lifestyle, seasonal regime, daily regime to stay healthy so that you don't gain weight and you don't suffer from any other disease. Thank you.
Okay, thank you. With that, thank you so much. And please help us share our sessions. Thank you. We are really happy when you say thank you, good, very informative. You have no idea. It makes our whole day. We work very hard to bring you these educational sessions from the top experts from all over the world. So thank you so much for being with us.